Good afternoon, everyone, and welcome to our latest Facebook Live event. My name is Andrea Roan, and today we're talking about the COVID-19 vaccine. Through our conversation today, we want to continue building the confidence we need to put this pandemic behind us as soon as possible. As you have heard, so much has changed since our last Facebook Live event back in March. The light at the end of the tunnel has never been brighter. Just last week, the CDC ended its mask wearing recommendation for vaccinated people, fully vaccinated people in most cases. Capacity restrictions on businesses also began lifting across our region. Now, everyone over the age of 12 is eligible for a vaccine, regardless of medical history. And remember how you had to register and wait for an appointment call or an email? Well, now you can just walk up to many clinics in the district in Maryland and get vaccinated almost immediately. Supply, no longer an issue, and over 35% of Americans have taken advantage of the vaccine. By all accounts, the vaccines are working. They've shown to be more than 95% effective in real world studies. But even as things start to improve, we know that many newly eligible people are just starting the process of deciding whether to get the vaccine or not. Some young people are asking, do I really need to get vaccinated if I'm not at risk for severe symptoms? And women of childbearing age might still have some questions about the vaccine, fertility, and pregnancy. Also, some big developments in the news might have you asking other questions. Well, today we hope to have a transparent and, most importantly, helpful conversation with our panel of experts as we attempt to answer all your questions. Let's meet the panel. Joining me today, Dr. Maria Elena Ruiz, infectious disease specialist at MedStar Health. Dr. Tamika Agusti, an OBGYN at MedStar Health and fellow at large with the American College of Obstetricians and Gynecologists. Dr. Angela Thomas, Vice President of Healthcare Delivery Research at MedStar Health. Laurel Farmer is a student at Towson University. She recovered from COVID-19 and is now vaccinated. And Mashan Bowman, our social media specialist, who is going to help us monitor your live questions. And please don't forget to ask your vaccine questions in the comment section below. We will get to as many of them as we can later in our broadcast, but we do want to hear from you. We'll begin our discussion today with Dr. Ruiz to put into context a couple of the big news stories that have recently reshaped the pandemic landscape. First, the big news, the CDC dropping its indoor and outdoor masking recommendation for fully vaccinated people, which had been in place almost since the beginning. Dr. Ruiz, what changed in the science? This is basically a threefold question. What changed in the science? What does it say about where we are right now regarding the pandemic? And what do people need to keep in mind as governments loosen their masking requirements? First off, what changed to bring about this loosening the masking indoors and outdoors?
Sure. I mean, what's changed is that as we vaccinated more people and gotten more data, we know that the vaccines are really effective and that people who are vaccinated are unlikely, very unlikely to get COVID. And even if they do, they're asymptomatic and many times will have a low chance of transmitting the virus because of the low level of virus that they have in their nose or in their secretions. So that's what's changed. I would say that in terms of the mask mandate, really not much has changed in the sense that when we look at the number of people that are vaccinated in the United States, it's about, let's say, 40%. Now, fully vaccinated means 2 weeks beyond that. So let's say it's a little bit less than 40%, let's say it's 35 or 30, that means that the majority of people still need to wear masks. And so what we do know is that people who are vaccinated, fully vaccinated, are at lower risk to acquire COVID. And in terms of where we are, I think we're turning the corner. We really are. But as I said on our last Facebook Live, we can't lose our heads. We've put in so much effort. It's been a year of sacrifice, and we can't sort of just throw caution to the wind. I know it's hard. It's been frustrating for everyone, but we still need to be mindful for people that are not vaccinated.
All right, that's what we need to know as governments are not just loosening, but eliminating all mask mandates. The other big story was that 12 to 15-year-olds are now eligible for the Pfizer vaccine after approval from the FDA and CDC. Another 17 million people potentially getting the vaccine. the youngest group yet to be eligible. Dr. Ruiz, do you agree that younger people, including this age group, should seek out the vaccine? And if so, why is it important to the rest of us as well?
I think it's very important. One, this is the group that is healthy and likely to have an excellent vaccine response and thus be fully protected versus adults who may be older or immunosuppressed or be on medications that prevent them from having a full vaccine response. The other thing is this is the age group we want to get back into schools. And also these young kids sometimes may bring COVID into their home. And so for us to move forward as a country, we really need everyone to be vaccinated, everyone that is eligible. And I think it's exciting that this is where we are right now.
Very good. That brings us to Laurel Farmer. She's not quite that young. She's an oldie at 19 years of age. She's a rising junior from Towson University. She's not part of this new age group, but as a teenager, she can speak about younger people and what they're thinking. Laurel, I said earlier that you had COVID. You're recovered from that. Tell us a little bit about your background, your COVID-19 experience, and get us started.
So I'm Laurel. I am a rising junior at Towson University. My freshman year was the only normal year of college I've had so far due to the COVID-19 pandemic. And yes, I did actually have COVID. I got tested at school because they were requiring that. Everybody, all of the students on campus were in groups. And so we had to get tested frequently. And one of the testing days, my test came back positive, but I didn't get my results until 5 days later. So I only had to quarantine for about 2 days at home. And those 48 hours, I thought I was going crazy. I couldn't imagine being isolated like that for any longer.
Did you have any symptoms, Laurel?
No, I didn't have any symptoms. I was completely asymptomatic. I didn't even know that I had it.
When it came time for you to be eligible for a vaccine, though, you decided to get the vaccine. Why? And did you have any hesitancy at all?
I had absolutely no hesitation about getting the vaccine. I was fully prepared to be patient and wait my turn, with my age group, because I knew that there were people ahead of me, such as like healthcare professionals, teachers, elderly people who needed to get the vaccine first. But I was 100% ready to get it because I'd never experienced a virus that left me completely asymptomatic, but was affecting other people on a serious, even fatal level.
Mm-hmm. When you talk to your fellow students, what's their view of the vaccine and your reaction to what they say?
A lot of my peers are actually not excited or motivated to get the vaccine. And that's shocking to me because, we've been, as Dr. Ruiz said, it's been a year. So this is not new, even though, the mask mandate and stuff has been lifted, we still do need to be mindful. And I believe that if people want to do things, they're going to have to get the vaccine. So I'm honestly shocked when I hear people say, oh, like I'm afraid of getting it, or, oh, I don't really want to get it.
All right, let's move on to Dr. Thomas, because we're talking about groups of people who are hesitant and not sure about what they want to do. Dr. Thomas, we had been talking a lot about reaching minority communities and those over the age of 65, letting them know that the vaccines are safe, effective, and trustworthy. Big outreach toward this group. Tell us where we are. How are things going for communities of color and these older citizens?
Yeah, I think there's been a lot of work done, as you mentioned, to target this particular group and to have conversations, one-on-one conversations, leveraging trusted messengers, community leaders, healthcare providers. A lot of organizations really rolled up their sleeves to move the needle in our community. And I think we're at a really good spot in terms of those. There was a lot of hesitancy at first, but we were able to use those efforts and get people vaccinated. There was a space where there was where demand was exceeding supply. That resolved itself. And there are lots of folks, which I can proudly say have changed their minds, are fully vaccinated at this point, et cetera. However,
yes, however,
still there does remain some folks that are hesitant. And I would say comparing the conversations from earlier in the vaccine rollout to now, they're pretty anchored in their positions of hesitancy. And similar to the early conversations, there isn't a one size fits all explanation, nor is there a one size fits all approach to kind of move that needle. And I see some patterns where the older community seem to, there's a few that I know that are still hesitant, but for the most part, they have made their decision, they're fully vaccinated, they were waiting their turn, they got their vaccine. And middle age, pretty much okay. It is Laurel's age group, even though Laurel's a superstar and has gotten her vaccine. You know, I was saying yesterday with this group that we have 5 kids. My husband and I, a blended family of 5, 24 to 33, and 5 out of 5, no vaccine. So I am seeing that pattern. Do I know others that are Laurel's age and that age who have gotten that vaccine and as gung-ho as Laurel about was waiting their turn to get it? Sure. But they're in our community, that younger millennial group tends to be pretty hesitant.
All right, so we'll come back to the expert to see how she's getting her blended family, what the message she's using. Right now, we'd like to turn to Dr. Agusti, another group who still may have some big questions about the vaccine, pregnant women. There were concerns expressed early on about how the vaccine would affect them and their unborn child. I'm sure this is at the forefront for you in your role with the American College of Obstetricians and Gynecologists. Doctor, can you explain ACOG's position on the vaccine and its current recommendations for pregnant women?
Absolutely. Thank you very much for that question. So the American College of Obstetricians and Gynecologists are very clear on their recommendations about the COVID vaccine and pregnant women. The recommendation is that the COVID vaccine should be available and given to pregnant women. Now, I understand because it was very clearly stated that in the initial trials of the COVID vaccine with all the different types of vaccine types, that there were no pregnant women included. So what did we do? We looked at the science in terms of how the vaccines worked, and we looked at the science and we know how that vaccine works in relation to pregnant women. And we knew that it would be safe. Fast forward now, since the vaccines have been out, we have hundreds of thousands of pregnant women who have received the vaccine and are in follow-up and looking to see if there's any problems. And the great news is no red flags, no problems in the pregnant women who have subsequently delivered. And the good news is in pregnant women who received the vaccine, those that delivered babies, their babies have antibodies to fight off the COVID virus. So that's the best news of all. So if you're pregnant and you'd like the vaccine, please go ahead and get it.
Dr. Agusti, you said that pregnant women were not in the initial trials, but there were women in those trials who didn't know at the time that they were pregnant. What is the data telling you about how they're reacting, and are they part of this group that you now know delivered healthy babies?
Yes, they are. For those women that did not know they were pregnant at the time, they have been followed very closely and have had no untoward events, no problems, and their babies too are coming out with antibodies against the COVID virus. So it's a win there as well.
Almost a win-win situation. Dr. Agusti, thank you. We're going to take a break from talking to the panel and go to Mashan Bowman, our social media specialist. What are the questions coming from our audience, Mashan?
Thanks, Andrea. So we have a few questions coming in from social media. Thank you for tuning in and sharing your questions with us. The first one I have is for Dr. Ruiz. This is from Martin, who says, what happens if you have COVID while unaware of it? Maybe you're asymptomatic and you get a shot. Or what do you do after your first shot and you get COVID? Is there a waiting period, or can you get the second dose at a certain time, or do you have to start over?
So if you're asymptomatic and you get the vaccine, really nothing should happen. It is possible that if your body is mounting a response and that's kind of amplified by the vaccine, you may have a little bit more symptoms. And we do know that young people with good immune systems may have a little bit more fever, tiredness, achy body. If you do get COVID after you've gotten the first vaccine, there'll be a waiting period after you recover to get the second dose. but it's not recommended that you get an extra dose or start over. And this is something that you can discuss with your doctor, and they'll advise you if you do test positive for COVID.
Thanks, Dr. Ruiz. I have a second question. This one also for you. This comes from Renita, who says, if you are on blood thinners, do you need to stop that medication before and after you get the COVID vaccine? And if yes, how long before or after the shot should you stop taking that medicine?
Thank you, Renita, for that question, because I actually think it's one of the questions that is asked in some questionnaires before you get the vaccine. You should not stop any of your medications. It is safe for you to get the vaccine with a blood thinner. Anytime a person that's on a blood thinner gets blood drawn, gets an injection, there may be a little bit more bleeding. So the reason that sometimes that question is asked is to make sure that they watch you, that they put pressure on the vaccine site, but you do not have to stop your medicines and you can go ahead and get the vaccine.
Great. Thank you, Dr. Ruiz. Back to you, Andrea.
All right. And I can add to what Dr. Ruiz said about someone on a blood thinner. My mother is, I shouldn't say, she's 90 some plus years old and is on a blood thinner and had her Pfizer vaccine, no ill effects, didn't stop her medication, second dose, no ill effects. She came through it beautifully. So if she can, in that upper age bracket, those in the younger age bracket should take some confidence in that. So that's my personal experience. Thank you, Mashan. Let's talk about what's working in the vaccination effort. We're talking about this young group, middle-agers, how to get them vaccinated. Almost 160 million Americans have received at least one dose of the vaccine, and the White House hit its goal of vaccinating 100 million Americans in 100 days, much earlier than expected. At the same time, the temporary pause on the Johnson & Johnson vaccine after some extremely rare reported cases of blood clotting in younger women threatened to erode the trust. Dr. Ruiz, can you explain to us exactly what happened with the Johnson & Johnson vaccine and what happened to put it back into rotation?
Sure. I think this should give us confidence with how the government, the FDA, the CDC reacted to these events. One thing that everyone should know is that any time in the United States that a vaccine or drug is approved, there's a period in which the scientific community, the medical community monitors for effects that might not have been seen in the trials. And this is what happens. So we have a robust system, and these thrombosis, which means a clot in your body, and thrombocytopenia, which means low platelets, which can cause bleeding or easy bruising, were observed. There were not many cases, around under 30, around there, of millions of vaccine doses that were given. But there was a pause both to educate the public, to educate the medical community, and to really understand what was happening. And what was, after the review of the cases by the panel, what they found was that 7 out of 1 million women, usually 18 to 49, could have this reaction, and that the reaction was more common anywhere from 7 to 14 days. Why that is helpful? In that if you got the Johnson & Johnson vaccine, or if you get it, that is the period to watch. If you notice easy bruising, lightheadedness, abdominal pain, you should come to your doctor. But also for doctors, for us to know what to do and what to watch out for. But in the end, the benefits of the vaccine, the life-saving effect of the vaccine outweighed this very rare side effect. By the way, not seen in men at all.
Dr. Agusti, Dr. Ruiz said it's not just a matter of educating the public, it was educating the medical community, and that's your community as well. Since you deal with mostly younger people in the fertility grouping, that Johnson & Johnson discussion, how did you assure them going forward that the vaccines, all of them, were safe, especially the Johnson & Johnson? What were some of the questions your patients were asking you specifically about that vaccine?
Great. Thank you very much. Again, great question. So just like Dr. Ruiz said, the pause that was taken was needed so that the medical community could really look at what happened. And when we found out and saw that this number of cases, 6 to 7 per million, were low, if you think about it, in a million of cases, 6 or 7 people are affected. Yes, they're predominantly women. American College of Obstetricians and Gynecologists looked at this science, and the recommendation, and what I tell our patients, is that this complication is so rare that it should not prevent you from obtaining or getting that vaccine. One of the questions that came up was, if I'm a woman of reproductive age and I am on birth control pill and I'm supposed to get the Johnson & Johnson vaccine, should I stop it? The answer is no. That has been one of the biggest questions that has faced our specialty as well. Because of the rarity of this complication, it is still recommended that women of reproductive age can get any of the 3 vaccines that are out there now.
Dr. Thomas had talked about trusted messenger. It goes back, Dr. Agusti, to the trust that your patients have in you and having a complete conversation, not just you telling, but them asking questions and answers as well, correct?
Absolutely. What comes down to this, and this is what we want to emphasize, is that if you have questions or concerns, let's have that conversation with your medical provider, with your healthcare provider. You know, we across the board, we are all doing the work as well to provide our patients with the answers to their questions. So if you as a patient have a question, have a conversation with your healthcare provider. We're going to have the answers, and if we don't, we're going to get them for you so that you can make the right decision in obtaining the vaccine.
Again, talking to the younger person, Laurel, you mentioned to us that you have now become an advocate for the COVID-19 vaccine at your school. And as a younger woman yourself, what are you saying to other young women and men who have questions about the safety of the vaccine in light of all that's been in the news? And how do you react when they still are a little bit hesitant about it?
Thank you. So in most cases, when I'm telling people, you know, like go out and get your vaccine, anybody who has any type of, you know, hesitation or, you know, apprehension towards getting it, my immediate question is why? Mm-hmm. And back to what Dr. Agusti was saying, please educate yourself. It is so important to know the right information about these vaccines. And if you're just saying, oh, like, you know, it's something that I've never heard of before, I don't know if I want this in my body, why? Please read about it. Please talk to somebody who you feel can educate you thoroughly in the right way. And when people, as you said, when people, you know, are kind of like, yeah, like I don't want to, you know, get involved with this, I have resorted into using, some might call it aggressive peer pressure, also known as bullying, but I have been over the shoulders of my friends while they're making appointments to make sure that they have confirmed their time and that they're going to get it for their first and their second dose.
All right, Laurel, we appreciate your efforts. And that brings us to Dr. Thomas mentioning that the medical community is having success in delivering the right information to those who are making this important decision. The community knows now that the vaccine eligibility is expanding. How are you working to instill confidence in other groups like Laurel's group? Because researchers at UNC say no single message can do the job, as there are no single reasons for the hesitancy. As you told us earlier, you have a blended family, 5 young people in that group that we're trying to reach. What's your message to them? How difficult is it to get this message out to them?
Yeah, it is individual conversations. And so while probably earlier in the vaccine rollout, there were some really, really common things that you can, as a group, small groups, trusted messengers, kind of address that and move a few people at a time. It is one-on-one conversations. Hopefully, you know, more conversations with mom or stepmom, but maybe more conversations with a peer like a Laurel about, hey, tell me, I'm in your age group. We live the same walk. You know, they can see mom as, of course you'll say that. You're in the medical community and the scientific community. But when you're talking peer to peer, that might be the trusted messenger that will help with some folks, or it's of the same political affiliation, you know, whatever that is for that person, having someone that they trust that maybe at one point shared the same views or can see things they perceive, can see things from their perspective, can be really influential here. The other piece is we may just get to a point where to move the rest of the folks, it becomes a matter of mandating so that they can do some things that they desire to do in similar ways as we do with measles, mumps, rubella, and other vaccinations that are out there.
That's why we stress the fully vaccinated now have the freedom that they've been waiting for. Talking about no single message, no single reason. Earlier, we were discussing a New York Times article that broke down hesitancy groups into 4 categories. They're skeptics, cost anxious, the watchful, and the systemic distrust of the system. I didn't understand the cost anxious. That means these people are afraid that they can't afford the vaccine. Dispel that notion, Dr. Thomas. The vaccine is not something that can hurt you in the pocketbook.
That is correct. You can get the vaccine for free. So that's the easiest message for me. Of the 4 categories you just read, cost should not be a barrier at all. That's the easiest group, I believe, that we can move just simply with that message, and increasing the confidence that they don't have to give insurance information. They don't have to give any financial information, credit cards, cash, check, none of it. Go get the vaccine.
Of the group, the system distrust, the watchful group, the skeptics, the cost anxious, who are the hardest to make the case for the vaccine, in your opinion?
I think it's the skeptics I would put as number one. There's skepticism around a lot of different pieces to this puzzle. Skepticism that COVID even is real. Skepticism that it's as bad as they say it is. Skepticism around what's in the vaccine. Skepticism around will it really work. Skepticism around the motives behind the vaccine. There's so much skepticism. And so I think that's the hardest bucket. And then I would put really as a real close second is the systemic distrust. And a lot of groups have some really, really valid reasons as to why they sit in that space. And that systemic distrust didn't happen overnight. It's not gone. There are valid reasons today to have that mistrust. And so it's going to be more difficult for those who are anchored in that as the reason to move that needle. But I also think it could be the case where those who share systemic distrust yet still decided to get the vaccine may be those most trusted messengers for that particular group.
All right. Thank you very much. Let's find out what our audience is asking. Mashan?
Thank you, Andrea. So I have another question for this one for Dr. Agusti. This is from Linda. Thank you, Linda, for tuning in and sharing this. She asks, have you heard of women getting night sweats after getting the COVID vaccine?
Thanks for that question. So I think when it comes in terms of night sweats, it's not just women. I think that is an potential side effect of getting the vaccine, not necessarily unique just to women. I haven't heard of a lot of cases. It's not one of the more popular ones or more common ones, excuse me. But I think that we do know that is a possibility to have the temperature irregularities or to feel like you are shivering when you have after the vaccine, but again, not necessarily solely just to women.
Thank you, Dr. Agusti. I have a question for Dr. Thomas. This is from Kathy, who says, when do you expect that the FDA will approve these vaccines?
Well, I'll tell you what I know. I know that Pfizer a couple of weeks ago did apply to the FDA for the full approval. That's the only one that I'm aware of that has started that application process. And then from there, I'm not sure how long it'll take before FDA will render a decision that way, but they at least have started the process to get full approval for Pfizer only.
Great, thank you, Dr. Thomas. I have another question for Dr. Ruiz. This is from Jennifer, who says, is the COVID vaccine safe for stage 4 breast cancer patients with bone metastasis? And what do you say to those who have concerns about getting the vaccine?
Sure, thank you for that question, Jennifer. I think the COVID vaccines are safe for people that have cancer, that are on chemotherapy, that are taking immunosuppressants, and it's precisely that group that needs to get them. I think it would be important for you to get vaccinated and also to get your household vaccinated to make sure that no one brings in COVID. But I would encourage you to get the vaccination. There's no contraindication with advanced stage 4 cancer.
All right, great. Thank you, Dr. Ruiz. I have another question. This is also for you, Dr. Ruiz. This is from Andy. So he's a local DMV ballroom dancer, and he's asking, can fully vaccinated people safely dance with one another? He's an OR tech and he's ready to dance. He's fully vaccinated and ready to go. So what do you say?
I would say probably. What I would say, like with any risk calculation in terms of safety, is to really have an open conversation with your partner and to really understand what fully vaccinated means, that you're both beyond 2 weeks. I think if I were to do something like ballroom dancing, I would try to limit the number of partners that I have to make sure that I'm really only coming into contact with people that I know are fully vaccinated, maybe do it in a well-ventilated area as much as it can be.
All right, great. Thank you, Dr. Ruiz. Back to you, Andrea.
All right, thank you, Ms. Shannon. I want to follow up with Dr. Ruiz about one of the questions dealing with someone with cancer. During COVID, at the height of COVID, most of women said they didn't schedule their mammograms because they didn't want to be exposed to anything outside their own little pods. Are there best times to get the COVID vaccine and the mammogram? Because now people are talking about false positives. What's your recommendation for someone who needs to get back on the books and get their annual mammograms? When should they get the vaccine? When should they schedule their exam?
So probably do the mammogram and then the vaccine. The issue with the vaccine is some people can get enlarged lymph nodes, and that can be picked up by the mammogram. And so one of the things that will happen when you schedule your mammogram, now that we know this, is they're going to ask you when your COVID vaccine was, your last second shot, and you must wait a few months before you get the mammogram.
All right, but it's safe to get it even if you're going to get a mammogram eventually. Get back on the books is what you're saying.
Yes, it is. It is. It's just a question of timing. And again, this will be addressed when you schedule your mammogram. And if it were me, what I would do if it's a routine mammogram is maybe get your COVID vaccine, get that out of the way, and then schedule your mammogram.
All right, good advice, Dr. Ruiz. Thank you. Now we want to talk about where do we go from here, because we do seem to be going to the end of that tunnel. That light, as we said, is getting brighter and brighter. Many of us vaccinated, but still those who are not. The weather's getting warmer, cases are going down, fewer deaths being recorded nationwide. Masks are coming off all over the place. People are making plans for vacation for the summer, seeing family and friends again, all good things. For the first time, our leaders are in agreement that it's okay, as long as you're fully vaccinated. We underscore fully vaccinated. Dr. Ruiz, let's talk about summer camps. A lot of families are planning for that, activities for their children who are not yet vaccinated. What are you recommending for families right now going to camps and their children under the age of 12, not eligible even for vaccines?
Right, so for them, not much has changed. And if I were a parent trying to enroll my child in a camp, I would look at the COVID procedures that they are following. There will still need to be masking for those who are unvaccinated, and probably some limitation of the limit, either by creating pods or keeping groups separate. I am aware that some camps are also doing testing to ensure that, that pod has not been exposed to COVID. But if for children younger than 12 that are unvaccinated, they'll still need to mask. And we do know that even, singing outdoors and things like that, which we know outdoors is safer, has transmitted viruses. There have been, parties, barbecues, whenever people are eating, talking, singing, there can be transmission.
It's hard to know what to do, as there is not one single procedure from state to state, even from county to county. You really have to do your homework, is what you're telling parents, correct?
That's correct. And I think each person needs to make a decision about and talk to the people that are around them about, kind of where they are in their vaccination journey and what, their risks or their exposures are. And I think, we talked about this, and for me, I think one of the difficult things for families is that the younger children are not vaccinated, and thus they're going to have to wear masks. So personally, I think I will still wear a mask because I want to model good behavior and not make the children feel like they're left out and they're the only ones that have to wear a mask.
When COVID first started, we were talking about one disease. Then we started hearing about UK and South Africa, Brazil, all these different variants, and people are very concerned about that. How do variants work, and how does that relate to our vaccination efforts, Dr. Ruiz? And some experts believe because COVID is a seasonal virus, we should expect a surge in the fall and winter. Your thoughts on that?
Sure. So what I would say is, what the variants mean is a virus that has changed in some manner, and some changes may not lead to increased transmission or maybe a more virulent virus or a stronger virus, if you want to put it that way. But some of the variants are like that. The vaccines do work against the variants, some better than others, some variants better than others. But it's something that we're still understanding. But the reason to get vaccinated is really to prevent more variants from arising. We know that variants arise when there's a lot of virus, when there's a lot of transmission. And so the virus has a chance to keep changing and reproducing and dividing. And so I think if we want to prevent variants, what we need as a country is to really get vaccinated.
And how likely will we need booster shots?
It's hard to say, but I would say we're probably looking at a booster shot sometime down the line. I think we need to understand how long the immunity lasts, and it's something that we're working out. But I think it is foreseeable that we may need a booster at some time in the future.
All right. Dr. Thomas, when it comes to those variants, we've heard voices in the media advising young people not to get the vaccine because it may not affect their own personal outcome. Forget the people around them, their own personal their outcome. Dr. Fauci says that isn't the right way to look at it. Do you think those who've yet to make a decision about the vaccine are getting the message about the importance of stopping the spread of the virus, even if they aren't at risk, for their friends, their loved ones? We talked about grandparents and great-grandparents. And if they're not getting the message, again, what's the strategy to get them to at least consider the vaccine?
Yeah, I mean, there is a group where they are very internally focused, so worried about whether or not it affects them. And I think for those that I've seen where they articulate like a Laurel that it's important for me not to continue the spread in my community, they've been touched by the virus some kind of way. So a loved one has been touched by it, or someone they care about, etc., or someone they know who they care about has been touched by it or has someone that they care about. And I think that is what will move the needle there. Unfortunately, there are folks in our country who really don't have that default community mindset. And as a public health professional, you wish that everybody has that mindset, but you don't necessarily have it. And so, yes, I feel like the message is penetrating for some, but I feel like that same message, they can hear it, but it's not penetrating for others. And again, for that residual, it may boil down to mandates and requirements some kind of way.
As you're saying, mandates and requirements, Laurel, at Towson, it is a mandate, a requirement to come back on campus in the fall, staff, faculty, and students to be vaccinated. How are your friends and associates reacting to that mandate of having the vaccination in order to come back to campus?
So a lot of my friends and my classmates at Towson, they aren't coming back because I personally believe it's because they don't want to have to be required to have any vaccine to come back on campus.
But Laurel, they are required to have vaccines like meningitis vaccines, yes, other viruses that need vaccinations. Why is the COVID vaccine such a lightning rod, such a touch point for these young people? Why is it being treated differently?
I think in short terms, it's just because like people fear what they don't know. For me, like with this COVID and my college experience, it literally was a random Thursday in March. And I was leaving my Spanish class and I got back to my building and the person at the desk was like, hey, you might want to pack enough stuff for 6 months. And I was just like, what are you talking about? Like, I don't even know, like, what is even happening? What do you mean 6 months? So I think a lot of it is just like people are afraid of what they don't know. And they're just unsure because we've never been in a situation where like children can't go to school. Like something has been so serious that children are not going to school. So I think it's just like the skepticism and fear of, like this has been on for a year. And, people are just like not ready to accept that the only next step is the vaccine, regardless.
Just keep talking about it like you're doing, Laurel. Dr. Agusti, as we look ahead, one of the possible major questions for young families, how to plan activities with their babies. We've talked about the children, the younger children, but the babies and those who are not in clinical or just in clinical trials in Canada, and they're nowhere near getting a vaccine until maybe the end of the year. Talk again about the good news you were telling us about earlier, that a breastfeeding mom or newly pregnant mom, she's going to be passing on vaccine antibodies to her children through her childbirth or breast milk. Why is that so important? And again, why should they consider getting the vaccine?
Thank you. Yes. So that is the greatest news that we can around pregnant women and women who are just delivered and who are breastfeeding. The evidence, the science now in these past 6 months is very, very clear. For pregnant women, you get the vaccine, your unborn child, when they are delivered, has antibodies to fight against COVID virus. For our lactating women, even if you get the vaccine and you are breastfeeding, the antibodies that you make to fight from the vaccine, to fight off COVID, are getting passed to your new child, to your very young child through breast milk. So this is a great way, an alternative to protect your newborn from the COVID virus by you doing the right thing and getting the vaccine and getting vaccinated. So I think that this is a great option, especially if people are very concerned, if women are very concerned about their newborns. And what that means, there is a secondary way to get your newborns protected, and that is by you getting the vaccine and passing along the antibodies.
We know that women are concerned about their fertility, but we've also had some questions, Dr. Agusti, about men and their fertility being affected by the COVID vaccine. Any reason to believe that's a problem that we should be concerned about and that men should think twice about getting the vaccine because it could affect their fertility?
So this has been something that we have seen in social media. I have had questions from patients in terms of any of the 3 available COVID vaccines affecting fertility for women, and like you mentioned, for men. And to be very, very clear, there is no evidence at all, no scientific foundation to say that the vaccines impact fertility in women or men. This has been looked at. We looked hard through the science. There's no scientific reason that this is happening, and we are not seeing cases of it. So that is a myth, and I'm here to bust that myth. So not an issue.
All right, so much misinformation going around. This is serious, real information from Dr. Agusti. Thank you very much. Few 4 minutes, Mashan, for questions. Any questions for our panel?
Oh, yes. Thank you very much for tuning in and sharing your questions with us. Keep them coming. I have another one for Dr. Agusti. This is from Janine. She says, I'm fully vaccinated, but if I end up infected with an asymptomatic case of COVID-19, what is the risk of me infecting an unvaccinated child in my household?
Thanks, Janine, for that question. So again, you being vaccinated, if you're asymptomatic, we're learning more and more of the science that the transmission is very, very low. With your very small child at home, the disease has tended to be much milder in them. There's a very low chance of transmission. It's something you still need to be wary about and still take precautions. If you are found to be an asymptomatic carrier, I would again practice mask wearing, hand washing, particularly with your small child, and see if there's any way you can distance yourself as much as possible. If you're the primary caregiver, maybe not, but if it's a caregiving that can be shared, this is the time to share it.
Perfect. Thank you, Dr. Agusti. I have a question for Dr. Ruiz. This is from Sonia. She says, what if after taking the first dose of the Pfizer vaccine, she had an allergic reaction? This includes numbness and tingling, and she's not sure what to do or if she should get that second dose. What do you recommend?
So I think one of the things that we know is that when people get the second dose, there is a chance that you'll have a stronger reaction than the first time. Now, that's not 100%. Some people have symptoms after the first shot and not the second shot. The kind of reactions that we're concerned about are life-threatening reactions, things like closing of the airway, wheezing, low blood pressure. And that would be different than a reaction where someone has maybe, tingling or maybe a little lightheaded. Or fever, for instance. There are people that have high fever. So I would say if there's concern, talk to your doctor. But if it's not a life-threatening reaction, you should go ahead and get the second shot.
Thank you, Dr. Ruiz. I have a question for Dr. Thomas. This is from Mary Ann. She says, what conditions are considered immunocompromised illnesses, and will the vaccine not work as well in this group?
There are a host of those, and probably one of the physicians on the panel can speak better to that. But my recommendation, because a lot of immunocompromised people have asked me, should I get the vaccine? And my recommendation has always been to talk to their provider. That's always my first suggestion, but also to remind them that it is the immunocompromised who would have typically some of the most severe reactions from getting COVID-19. So it's really important for them to have that conversation with their provider sooner rather than later.
Great, thanks, Dr. Thomas. I'll turn it over to you, Dr. Ruiz.
Yes, thank you. So things like HIV that's uncontrolled, where the CD4 count is low, advanced cancer, transplant patients, and people who are on medications either for inflammatory conditions like rheumatoid arthritis or Crohn's, something like some of the MAB drugs, high-dose steroids. Those are considered conditions in which the immune system is not as strong and may not respond as robustly to the vaccine. Now, that doesn't mean the vaccine won't work. You may just have a milder reaction. And it's something that we're working out what should be done with these patients. Right now, you should get your vaccine. And I'll tell you, this is not something new particular to the COVID vaccine. We know, for instance, in all other vaccines, hepatitis B, pneumococcus, flu, if the general population will respond at a 90% rate, some solid organ transplant patients will respond at a 60% rate. It still doesn't mean you're not going to respond. Your response may just not be as strong, may not last as long. But it is, like Dr. Thomas said, precisely that group that needs to be vaccinated. And again, we need the household to be vaccinated and your contacts to be vaccinated. And this is sort of the flip side. This is the reason the young people need to get vaccinated, because while they're not at risk, they're the people that are going to have a great response to the vaccine. And the more people that are vaccinated and immune, the safer all of us will be.
Thank you, Dr. Ruiz. I have another question also for you. This is from Brendan. So what do you recommend for a parent who is participating in a group event and they have their young child with them, but the child isn't vaccinated? What do you recommend they do?
Yeah, so what I would say is, children over 2 should wear masks. So if it's a child between 2 and 12, I would recommend that the children wear a mask. And this is what I was alluding to. It's very hard. You have a big group of people, everyone's having fun. And then for the child to see the parents not wearing the mask and they have to wear it, it's kind of a mixed message. And I think that is one of the reasons that even though some people are vaccinated, they may still have to wear a mask. And so what I would say to that parent is perhaps you should wear a mask too, to say, we're in this together and we're going to keep our family safe. The other thing I would say is, and it's something I do with my kids, is if you're going to eat, the people that are unvaccinated, you can get your food, you wear your mask when you're close to people, get your food, sit apart from people, then you take off your mask to eat. And it's something that I think, a parent can model so that it doesn't feel a little bit punitive for the little kids.
Thanks, Dr. Ruiz. I'll turn it back over to you, Andrea.
All right, thank you. And I think Dr. Ruiz said it before, we're all in this together. So that's a great way to help your kids understand what's happening on this public health emergency. We thank all of you who've been watching and sent in your great questions, and our panel has been fantastic. If you were with us in March, you remember I ended our conversation by asking each panel member if they saw a light at the end of the tunnel. Well, based on the breaking news we've had in the last couple of weeks, days, months, hours almost, we know that there is a light at the end of the tunnel and it's shining bright, but we still have a lot of work to do. At least a third of Americans still say adamantly they won't get the vaccine. This time, Dr. Ruiz, I close again with you. What's the end game here? At first, we were hearing all about herd immunity. Do we still have a chance to reach herd immunity? And what do we need to get there? is it still as important? You have the last word, Dr. Ruiz.
I hope we get to herd immunity. And I think, again, it's something we have to do as a country and as a community. And I think that for us to put this behind us, we need everyone to be vaccinated. The numbers are going down, the vaccines work, but I'll say that for me personally, I'm still seeing people die from COVID. And it's something that's very, very hard, especially now that the vaccine is available, because you know that either someone didn't take advantage of the vaccine or someone who was maybe asymptomatic or with low symptoms exposed that poor person to COVID. So the numbers are much better, but it's something that's still here and something that we still have to protect ourselves from.
The pandemic hasn't ended yet, but you can make a difference, as Dr. Ruiz and all of our experts have said, by getting the vaccine, taking care of your health, helping to take care of others. Panel, thank you very much, Dr. Ruiz, Dr. Agusti, Laurel Farmer, Dr. Thomas Machan. Thank you for handling the questions from our audience. They were great. We're going to wrap up the question with a little bit more homework and housekeeping here. If you still have questions about COVID-19 vaccine, we have a website you can visit. It's medstarhealth.org/vaccine questions. If you feel like you're now ready to register for a COVID-19 vaccine through MedStar Health, you can visit medstarhealth.org/sign up. Also in the district, we are now accepting walk-up appointments at MedStar Washington Hospital Center, MedStar Georgetown University Hospital, and at the High Capacity Clinic at Arena Stage. In Maryland, you need to reside in the state, but you do not need to be a MedStar Health patient to register with us for a COVID-19 vaccine. Many of our private care practices are also now providing the vaccine as well. So you have many options. Accessibility is no longer a major problem. Again, all of the information that I ran through is available at the website. It is medstarhealth.org/vaccine questions. Again, thank you all for being with us. Until we meet again, stay healthy and stay safe, everyone.